National Strategy to Reduce Heart Attacks and Strokes slated for 2023, a national strategy that focuses on reducing down on the number of people affected by heart attacks and strokes, two of the main causes of death in Cyprus, is expected to come into effect next year. Lawmakers made the announcement following a meeting of the House Health Committee on Thursday. Based on the data available from the Health Profile for Cyprus, the two most common causes of death in our country are ischemic heart disease and strokes, with 28% due to cardiovascular or underlying diseases, said the committee's deputy chairwoman, DCMP Savia Orfanidou. Orfanidou said that in the context of creating this national strategy, factors such as awareness, staff training, cultural change and prevention should be included. To tackle what she described as an invisible enemy, an invisible pandemic that should be tackled at its root, Orfanidou said all the relevant agencies are willing to begin preparations for this strategy in consultation with all stakeholders so that within a year's time, there will be a comprehensive national strategy which will include strategies already being run by the Health Ministry on smoking, alcohol, obesity and the need for exercise, CNA reported. She added that they also welcome the positions taken by the Health Insurance Organization and the State Health Services Organization towards strengthening this effort. And we look forward to seeing results in the best interests of the patient and the state in general, Orfanidou said. AKAL MP Marina Nicolaou said that the debate was set in the right direction, and that they would be following very closely the implementation of such an important national strategy which is essential for the country. She said that public hospitals have an essential and very important role to play in this process. Nicolaou said the immediate access to care for people suffering from a heart attack or stroke was vital, after hearing from guests at the meeting about the current reality, which sees delays in treatment due to the very heavy workloads. Time in stroke and heart attack issues is very important, Nicolaou said. Nicolaou also said that doctors should be provided with all the necessary tools, adding that it is not acceptable that a patient suffering from heart failure should be given certain drugs for 6 months and the GISI was only giving them 1 month's supply. The opposition MP appealed for a change in culture that will give immediate care to anyone who needs it based on scientific criteria. Chrysanthos Savidis, a DECO MP, expressed hope that the strategy will be implemented ahead of time. Savidis noted that these were two invisible diseases which need management that can be brought about through a national strategy. He said that in Cyprus there are about 1,000 cases a year, and it appears to be a rising trend, adding that if 25% of these cases are left with the side effects from a stroke, as the Commission has been informed, it means that this affects about 250 people a year. He said that DECO is in favor of a national strategy, but that it should include 5 key pillars, including maintaining complete statistical data, enriching pharmaceutical formulations because, he said, there are gaps, increasing rehabilitation centers, maximizing the information campaign on these diseases in general and in schools, and direct access to treatment by patients.